Hello everyone, I am Bharati, lecturer from Department of Radiography and Imaging Technology at the SNS College of Allied Health Sciences in Coimbatore. Today we are going to look upon a topic foreign body radiograph, where the radiograph of the foreign bodies which are contact with the body are imagined. Move on to the introduction. A foreign body is an unwanted interfering object that entered the body by accident. The foreign body placement in the body, which is either voluntary or involuntary. The involuntary placement is a result of an accident. The foreign body may cause infection or can obstruct the passageways. Photograph of sample of wood, glass, metal items, which are radiographic images of the object. They based on the density of the object, the contrast of the image of an object is vary. The foreign body may enter the body by the following ways, like 5 ways. First one is percutaneous foreign bodies, which the object is accidentally entered into the body, like metal pieces, nails, glass, or wood chips. It causes infections, inflammations, or damage to the surrounding tissues. For evolution of the percutaneous foreign body, the AP view or lateral projection of the affected limb is taken. So here are some examples of the foreign body, percutaneous foreign body examinations. Dorsiplantar and lateral image of the thumb showing embedded nail in the distal soft tissue. Here the AP view, anterior-posterior and lateral image of a right elbow demonstrating multiple needle insertions. Then ingested foreign bodies, where the object is unintentionally swallowed, such as coins, pins, needles, and dentures. Tooth implants. The object larger than 2 cm cannot pass through the pylorus, so it will cause obstruction or perforation of the intestine. For evolution of the ingested foreign body, the neck AP and lateral, chest AP and lateral, and abdomen AP projections are taken. So here is an example of ingested foreign bodies, where the fish bone, which is unintentionally entered into the esophagus. By use of barium sulfate like procedure, barium swallow procedure, the outline fish bones lodged in the upper esophagus. Inhaled foreign bodies. The object is accidentally inhaled and stuck in the airways. If the foreign body trapped in the lung, it needs bronchoscopy to visualize the presence of the foreign body. The AP projections and lateral projection of chest showing a screw lodged in the right main bronchus. For evolution, we have to take neck AP and lateral and chest AP and lateral projections. Inserted foreign bodies. The object is inserted into the cavity or orifices of the body, such as pen, pin, or other objects inserted into the nasal passage or in an ear or the affected part. The lateral and PA of facial bone showing the screw in the right nasal septum or cavity. The portable anteroposterior chest taken in theater to locate the missing swells. The anteroposterior of the pelvis showing a vibrator placed inserted into the rectum. For evaluation of the inserted foreign bodies, the AP and lateral projections of the affected part is taken. Transcircular foreign bodies, where the object is accidentally entered into the orbital cavity. For evaluation of the translocular foreign bodies, the occipitomental 35° for the orbits modified view, then optic foramina PA view posterior anterior oblique is taken. The CT image showing multiple foreign bodies present in the orbital cavity and the surrounding soft tissues. The modified occipitomental 35° view showing normal radiographic view. The treatment for removing the foreign body may include the following: by using a suction object to remove the foreign body present in either nose or ear. Then bronchoscope, which is used to visualize the presence of the foreign body and also used to remove the foreign bodies. Then endoscope, which is used to remove the foreign bodies which is present in the stomach or rectum. Then surgery. Surgery of the foreign body is necessary if the removal of the object is not possible. General guidelines for foreign body radiography. Before performing the X-ray examination of the foreign body, the radiographer should ensure that there is no confusing materials and also ask the patient to remove the confusing materials which is present on the patient's cloth, X-ray table or an image receptor. Then compression or dressing material should not be applied because it may cause movements in the foreign bodies and the foreign bodies moves further. The AP anteroposterior, PA posterior anterior and lateral views which are best demonstrate the appropriate locations of the foreign bodies in the limbs. Usually two projections, AP anteroposterior and lateral projections are taken. The oblique projections demonstrate the location of the foreign body to the neighboring bones like foot oblique, hand oblique or demonstrate the location of the foreign bodies in the neighboring bone. Then the tangential projections is used to demonstrate the depth of the foreign bodies in the face and chest and abdominal walls, like also in the skull bones where a small needles are injected into the skull, the chest and abdominal walls by using the tangential projections which are highly efficient to visualize the foreign bodies. The digital image acquisition, computer radiography and digital radiography are helpful in the visualization of low density foreign bodies compared to the conventional radiography. And the post-processing contrast manipulations and windowing may demonstrate low density foreign bodies and also the patient dose is reduced compared to the conventional radiography. A low KVP technique useful for demonstrating foreign bodies like glass, other low density materials, and a high KVP is used to evaluate the position of the inhaled foreign bodies. For screen film combinations like CR and DR, which gives the short exposure to prevent the geometrical unsharpness and also reduce the patient dose. CT or MRI, magnetic resonance angio imaging, is useful to demonstrate the location of the foreign bodies that is not viewed on the radiograph or ultrasound. where MRI is not preferred because the metal items are not allowed inside the MRI. So they may be composed of the materials. It may cause movements in the foreign bodies, which gives severe or chronic pains to the patient.